DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, flying solo today. But we're going to talk about some things as processing and working cows, working calves, some things that are just some general tips that we need to be constantly reminded of when we're applying products to make sure that they work correctly and that we don't injure the animals. We'll be right back.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and I'm a veterinarian. I've been doing this show now for 10, 12 years. We sure appreciate y'all joining us. We appreciate our sponsors very, very much. And I'm a veterinarian. I work at production animal consultation and feedlot practice and cow-calf and retail and packer, pretty much from conception to consumption. And also, I'm a part-time faculty member at Iowa State University, so get to spend time with students and really enjoy that as well. But today we're going to talk about product administration, and I'm basically going to say once the steer comes into the chute or the cow or the calf, I'm going to start at the head and then I'm going to work my way back, okay? And so when I first think about beginning at the head or product administration, one of the first things is our nasal vaccines that we utilize. And if we're using a intranasal product, we want to make sure that we get that product properly administered into the nares. We don't want to have it outside the nose. We want it inside. And we want to be careful. We want to be careful that we don't jam or make sure that the tip's on tight enough that we don't lose the tip in the nares and things to that nature. Really important. But probably the biggest thing up on the front or on the head that I'm running into lately is we have a lot of products on the market now today that are drench products. Drenches have been around for a long time, but now it seems to be more routine at initial processing and at reimplant and when we're treating cattle. So we have a lot of different types of drench guns and different types of cattle, different ages, receiving these drenches in the mouth. And when we take a look at these drench guns, one like this that goes clear to the back of the throat, one of the things that we have been seeing is if you're really rough with the cattle, or if you pull this, you push this in their mouth and pull it back, we've actually seen some of the laryngeal ulcers and laryngeal lacerations in the back of the throat. And I don't have to tell you that just having a sore throat is bad. But when we stick one of these things, if we're too forceful and we stick it through the side of the mouth, or we rough up the back of the throat, or we stick it through the laryngeal tissue and we get an abscess back there, these cattle, not only can they not eat, now we start having a tough time with them breathing because we start to get throats closed off and things to that nature. So drench products are great. Just make sure, this is a public safety announcement, that when we use these drenches that we're being very gentle and being very, very understanding. Getting it in the back of the mouth is important for product to be absorbed or to go down the esophagus. But also, when we put this in the mouth, make sure that we aren't causing more damage than we are good. Other things around the head: implant guns, implant needles, making sure those are sharp, making sure that they're disinfected so we don't get abscesses on the ear. Same goes with tagging equipment, making sure that it's sharp. Very rarely do we step back, and the only time we really replace that needle on a tagging gun is when we lose the other one, right? Or break it. Those need to be sharp as well. So those are some of the things up around the head. When we come back, we're going to move back to injection sites, needle selection, drawing out of the bottle, much more. You're watching Doc Talk, and I'm glad you joined us.
The Alertus on-farm pregnancy test for us has been unbelievable time saver because we can do it whenever we want. My favorite part about Alertus on-farm, we can get results fast. You know, in 20 minutes, you know whether that cow goes to pasture A, B, or C. It's just very efficient. It's going to make you a lot of money. You're not going to have open cows standing there all winter looking at you, and you can do it on your time.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thomson, and pleasure to be with you today. The next step back is obviously injections, and whether we're injecting vaccines or whether we're injecting antimicrobials or dewormers, we have what we call, as seen here, the injection site triangle. And the injection site triangle, the borders are the vertebral column, the vertebra in the neck, the nuchal ligament across the top, and the point of the shoulder, that's caudal. And if I passed a needle from one side, hide, straight through, the only thing I would hit is hide, muscle, hide. So that is the reason it's not a highly valued cut at that point. But most of our products are sub-Q, so we're going to get that product in the fashion between the skin and the fascia or the muscle. Okay, so the first thing I'm going to talk about are needles. And you know, we have, and I'm getting old, so I'm going to put these on so I know what I'm looking at. So when we're going to give an intramuscular injection, we're going to want to use a 1 inch or 1.5 inch needle. This is an 1.5 inch needle. It's longer, and this is the type of needle because then it would pass through the skin and make sure it got into the muscle, and it would then deposit that intramuscularly. Very few products are IM or intermuscular. If we are going to go subcutaneous, then we are going to deposit the product between the skin and the fascia, and we're going to use a smaller needle. Now this is a 1/2 inch. A lot of times I'll use a 5/8 inch needle, okay, for sub-Q, because then it decreases the chance of going on through into the muscle. It also, there's no need for that longer one, less chance of it breaking, different things to that nature. The other thing you have to do is select the gauge of the needle, and the pink tops are the 18 gauge or green, depending on where you're at. Gray or clear are 16 gauge needles, and a 14 gauge needle are the orange ones. Okay, now when most products, I will use a 16 gauge needle for almost everything. The bigger the gauge, the bigger the bore of the needle, the more the pain. You wouldn't want to get a COVID vaccine or a flu shot with a 16 gauge needle, and dang sure not with a 14 gauge needle. And really the only time we use a 14 gauge needle is if we're trying to cheat with a product that maybe is highly viscous to inject and it's cold in the winter, or we might utilize that needle to provide an intravenous or IV type of delivery. Rarely use 18 gauge, maybe vaccines and baby calves, but for feedlots, 16 gauge, 5/8 inch needle. Now, one thing you want to do is you want to replace your needle frequently. You want to change needles frequently. As you can see from this graph, or this picture from the Iowa cattlemen's, this is an electron microscopy of needles as they are injected into the animal. And so when we give an animal is the sixth in line to receive the injection, you can see the damage to these needles and the burrs on them. So now we're recommending every 5 to 10 head, let's replace the needle just to decrease the burrs that the cattle are going to be exposed to. When you're thinking about some of the products we use that are larger volume, if you're giving an antibiotic that's 50, 60 cc's and we're only depositing 10 cc's per site, we may have to change that needle quicker between animals because it's about the number of injections, not the number of animals, that causes these burrs. It's just something that we're focusing on more, and glad to share it. I'm going to take a break. When I come back, we're going to talk about drawing product out of the bottle, and we're going to start getting along that top line of the steer. Where you're watching Doc Talk, I'm glad you joined us.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thomson. I'm sure glad you joined us. I'm a veterinarian. I work a lot with feedlots, packing plants, starting to work with some larger cow herds and dairy on beef, you name it. We work with a lot of cattle, and I've got some really good veterinarians that work with me and some very special clients. Very thankful that y'all watch the show today. So as we move back, one of the things is drawing product out of your bottles too, correctly. When we never have someone put a needle on a syringe and stick that needle into the bottle and draw it out unless it's a brand new needle, okay? If that needle's been injected into the hide, there's a chance it could be contaminated with fecal matter or dander or something on the skin, and these bottles, these antibiotic bottles, can become infected. So rather than do something to that nature, what I will do is take a needle and take a brand new bottle, and I will take, and I better get these before I stick myself in the finger. I will take the bottle with a new needle, or a new bottle, and I'll poke some holes as such. I will then take my syringe and I will just pass the nipple of the syringe into the bottle, and that way I never have to inject a needle into that bottle. When these get contaminated, they can cause issues with injection site abscesses on the neck, and that's usually how we find out that we have a problem. I'll then put the needle on here, go give my shot, come back, take the needle off, draw up the next dose, put the needle back on, go give the injection. So something that we do, if we have a bottle and it's going to be set outside overnight and it's not put up in a cupboard, we will take a rubber glove and we'll put over the top of the bottle so that flies do not deposit manure. They can carry E. coli, salmonella. We keep them covered up into that nature. The next thing I'm going to talk about after injections is providing pour-ons. So we have a lot of pour-ons out there, great products, work extremely well. But the thing that we have to constantly remind each other is about administration of that pour-on. The proper administration is to start at the withers up front and apply that product all the way across the top line to the rump or the tail head, because we want to get good coverage all the way along that back. If I see someone that just comes up there with the pour-on, they just squirt it in one spot, that's not going to provide the protection that we want. So I want to make sure that I start giving that and I'm moving that. People are incredible at applying it, whether it's for lice and we have some pyrethrin products, or if it's a pour-on ivermectin product, we want to make sure that we move that thing all the way down the top line. The other thing I will remind you about pour-ons, a lot of these are alcohol based, and that means they're highly flammable. And I'm not saying never use a hot shot, because I think a hot shot can be a very good animal welfare tool and save on yelling, screaming, and twisting tails. But as we use those hot shots, if you have a steer that has just been poured and is in the chute and you arc on their back, that alcohol-based pour-on, being flammable, can actually ignite, and it is a blue flame. Don't ask me how I found out, but it can have a blue flame, and if that steer is let out, it will act like a drip torch going through your pasture, and you might start burning at a point in time in which you didn't intend to do. So we've talked about the head, the neck, the back. When we come back, we'll finish up at the old caboose. Thanks for watching DocTalk. We'll be right back.
We see you, working hard from the early mornings to the late nights and every hour in between. We see you. We see the pursuit, the desire, the effort, the hope, the goal of being a champion. And we see that you need a partner to keep your animals healthy and happy. With our countless products and quick and reliable shipping, together, we can do just that. To the cowboys and cowgirls, to the dreamers, we see you.
We are a start-to-finish yard. Bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. The most stressful part of the life cycle of a calf is the ride here, whether it's a 2-hour ride or it's a 24-hour ride. I mean, we kind of treat everything like the higher risk cattle. We always have somebody right there at the loadout, pinning cattle, getting counts on cattle. It's just consistently doing the little things right, whether it's clean water, fresh feed, clean pen, clean bunk apron. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. You know, that's something we really focus on. Our cowboys work directly with our veterinarians. You know, and our guys, they do a great job. Give them a few days to kind of acclimate, settle down a little bit. That gives us a period, what we know what we're working with and how we're going to handle them at the chute when we come to process them. We don't process till day 10, 14 or so, and we found better luck with that just because we know what we're working with. And it seems like if they're going to fall apart on you or, you know, start having some BRD issues, you'll find it within that 10 to 14 day period. And Mother Nature, as we know, it can throw a curveball at us anytime, so you never want to get comfortable. And we're using the stimulator now for a vaccine, and they don't go through a harsh sweat or anything. Blends, mixes really nice. Cattle look great afterwards, and every day is a challenge. But it's nice knowing that we can rely on a good vaccine, kind of protect us against what Mother Nature or any stressors that they throw at us. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect, you know, the drugs or what we put into the cattle to do their job too. And I think these Bimeda products, they're proving that they're doing the job for us.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thomson. I'm really glad you joined us. We're talking about product administration, processing these animals. One thing I failed to mention is that steers and heifers will vocalize before an improper or before a procedure if they're caught improperly or if they're caught at a funny angle. And a lot of times if they beller after you, right when you put on the squeeze, if you'll just let the squeeze off and let them stand up straight, they'll get along just fine. So that's something on the chute. And if you miscatch one by the temples, please always let it go and adjust its head so that you don't have it squeezed there. That's a bad experience for that animal in the chute. Now let's get to the back end. And there are two things I want to discuss. One is when we bob tails. And when we bob tails, there's a difference between bobbing tails and tail docking. Bobbing tails is to remove the switch or the hairs at the bottom of the tail to prevent manure balls on the tail, and to clean those animals up and to help them in their environment. Docking is when we cut the tail off, kind of like a dock tail on a dog, where the animal doesn't have a tail at all. So we don't recommend tail docking, and but we do recommend bobbing tails. And when we bob tails, we just take a knife and we'll wrap the tail, pull, and the hair, the switch comes here, we throw it away, the knife. You want to make sure that knife is sharp, okay? Because you don't want to pull the hairs, we want to cut the hairs. And the other side of this is you want to make sure that you don't get the end of the tail in your wrap. We've had some places that had some automatic tail bobbing equipment, like a guillotine, that they would stick it in there and they'd cut it, and it was actually taking off the end of the tail. And we can get what we call a tail tip necrosis. That tail tip necrosis gets infected. The infection actually travels up the tail, will get into the bloodstream, can cause swollen joints, can cause pneumonia, can cause just a plethora of issues of any kind of sepsis that you would think of. And we thought it was an infection traveling up the tail into the joints, but it's actually getting into the bloodstream. And so tail tip necrosis is something we want to make sure that we don't create when we're bobbing the switch. Then the last one, or the last two, are anything that we're going to put in the anus or the rectum of those cattle. Now, it may be an ultrasound piece of equipment, it may be a thermometer, or it may be your hand if you're preg checking. Couple things to remember, and I kind of tell the students or producers that we can create issues. We can create peritonitis. If you don't lift the tail and put the thermometer in correctly, and you stick that through the side of the rectum, you can actually cause a peritonitis, and those animals could die. When we start to have a rash of peritonitis, I will do necropsies back to where that thermometer is placed. So I just tell the students and clients and colleagues that, when you're putting a thermometer in the rectum of a steer, imagine it was how you would want it placed in you. And so that kind of lightens things up and it takes the pressure off. But how we ram and jam and hurry can be an issue. The other thing on gloves and OB sleeves, we're getting into more and more of an understanding of things on biosecurity that can be passed from heifer to heifer when we preg check, whether it's the ultrasound or whether it's a sleeve. I think you're going to see more to come on changing sleeves between animals and some understanding of disease transmission. We're not quite there, and when people start arguing and saying, well, I'm not going to put a sleeve, I'm not going to change sleeves between cows, I just remind them, I said, now what if your MD had that attitude? Standing there at 4 o'clock in the afternoon and you come in for your physical and they're standing there with their hand like this and he goes, oh, don't worry about it, I'm just trying to save a little money on gloves. Okay? I guarantee you'd have the 8 o'clock a.m. appointment every time. Anyway, it's been a fun show. It's been one I've been wanting to do for a long time. Hope you enjoyed it. Remember, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson from Production Animal Consultation, and I'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.